afternoon, everybody. Today is Tuesday, April the 21st, and I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Long, Regional EMS Director. Since our press briefing yesterday, we have 69 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 2,989. Now, for those of you who watch every day, don't get too excited about that number 69. It is simply a reflection of the fact that we got very few results back from the community-based testing site overnight. So I believe that that number is artificially small. Maybe I will be proven wrong, and that would be a wonderful thing. But for now, we believe it's simply a function of the fact that we did not get a lot of test results back from the community-based testing site overnight. These positive individuals are from 27 municipalities, none of which are reporting new cases. This keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals today range in age from 3 months to 95 years old. And as always, you can check our county map at montco.org/COVID-19 for an updated geographic list. Today's age brackets: 1 individual between 0 and 9, 1 individual between 10 and 19 years old, 6 between 20 and 29, 12 between 30 and 39, 8 between 40 and 49, 10 between 50 and 59, 7 between 60 and 69, 11 between 70 and 79, 9 between 80 and 89, 4 is the final, 4 between 90 and 99. We have 36 females and 33 males. 4 were known to be hospitalized, 11 to be at home in isolation, and 54 we have no information on. I'm also confirmed that 8 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 172 deaths. 5 of those individuals died in a hospital setting, 3 in a residence setting, and they range in age from 62 years old to 96 years old. Overall, in terms of lives lost, there have been 86 female and 86 males. The racial breakdown is 9 Asian, 2 Asian Indian, 3 Asian Korean, 19 African American or Black, 65 white, and 74 that we do not have information on. Happily, we continue in all of our hospitals to have beds available, beds both in the regular sections of the hospital as well as the intensive care units, and we continue to have ventilators available. And the thanks for that goes to everyone who did such a good job at staying home. And we really cannot continue to emphasize that enough. As we continue to track our long-term care facilities, today we have 83 facilities that are reporting positive cases of COVID-19. We have 39 facilities that have 1 to 5 cases, 15 facilities with 6 to 10, 3 facilities with 11 to 15, 7 facilities with 16 to 20 cases, 2 facilities with 21 to 25 cases, 1 facility with 26 to 30, 3 facilities with 31 to 35 cases, 4 facilities with 36 to 40, 2 facilities with 41 to 45, 1 facility with 46 to 50, 3 facilities with 51 to 55 cases, 1 facility with 56 to 60, 1 facility with 61 to 65, and 1 facility with 76 to 80. In total, this is 787 cases among residents and 377 among staff. And I just want to continue to point out on these numbers that these are numbers that are, for the most part, self-reported from these facilities. Not all of these individuals are Montgomery County residents, particularly among the staff and in some cases among the residents. So while we are able to do some cross-checking, we are also relying on some self-reporting from these facilities. Although these numbers don't roll up into our total county case numbers, we are tracking this and reporting this as a snapshot of the challenges that our long-term care facilities are currently under in this region. In total, we have 107 deaths of Montgomery County residents that are related to or were residents of long-term care or other congregate facilities. And that is out of our total of, I'm sorry, the percentage here today. Out of our total of 172 deaths, we have 107 that are from congregate facilities or long-term care facilities. We continue to do outreach to these facilities. There are daily attempts to contact, to provide phone guidance. We are starting to send teams of 2 out into some of the facilities that appear to be the most challenged. Again, I emphasize that we need to be invited in, as the county does not license these facilities and doesn't have the authority to just step in. We are working very closely with the Pennsylvania Department of Health, who does license these facilities, and hope to continue to convey to them how serious the situation is in Montgomery County. Next, I have an update from the Montgomery County Correctional Facility. We learned this morning of an additional inmate at the Montgomery County Correctional Facility that has tested positive for COVID-19. Correctional facility to 5 inmates who have tested positive for COVID-19 and 2 individuals for whom we are awaiting test results. 2 of the 5 inmates have recovered, so the 3 active patients remain in isolation and are currently stable. As a result of potential, we have 198 individuals in quarantine. All of them are asymptomatic. Than yesterday, there was a group of individuals who had been in quarantine for 14 days and have remained asymptomatic, so they have been released out of quarantine. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 966 today, a net decrease of 376 individuals, which is a 28% decrease. And the average number of daily commits is still around 4 to 5 or 6 typically, compared with 28 a day prior to the March judicial order. So at the moment, the drive-through testing site at Montgomery County Community College is closed because of the weather. We did not want to have any weather issues as we did the last time, so we closed at the beginning of the afternoon today. We, as I mentioned earlier, have got results back from the last 2 days of testing, so I'm going to defer any update on the total number of tests or the positivity results because I really don't have enough data to make it at all meaningful. The site will be open tomorrow, Wednesday. It will open, we will open 8 a.m. Wednesday morning for reservations. You can make an appointment at moncopa.org/COVID-19 under the green County Testing Information button, or by calling 610-631-3000. Just reminders today that we do have a waiting list now on this site, so if you log on or make a call and the list is full for the day, you'll be offered a place on the waiting list. The waiting list is only good for that day, so if you don't get called that day and asked to come in, go ahead the next day and try to get a regular appointment. And again, just a reminder, most of you probably know this by now, but we're doing a self-swab technique at the site where the individual swabs their nose themselves. There's plenty of instructions in multiple languages at the site and people who can help talk you through it. It seems to be going very smoothly. It is less uncomfortable than when someone was doing it to you at our other site, and so far that process seems to be working well. Today I just want to highlight that this week is National Volunteers Week. April 19th through the 25th is an opportunity to recognize the impact of volunteer service and the power of volunteers to tackle some of society's greatest challenges, to help build stronger communities and be a force that transforms the world. It's hard to imagine any other time in our county's history or our nation's recent history volunteerism has been so critically important than during the time that we're living through right now. The COVID-19 crisis has put unprecedented strain on our food and shelter and healthcare, public safety, and other resources. But volunteers across this county have been stepping up to fill those gaps and help protect and save lives. So just a couple of statistics, and the numbers I believe are actually much bigger than this, but we just pulled together a couple of quick things for you today. RSVP, which is a social services agency that's been helping the county coordinate volunteers, has gotten 200 new volunteers since March the 15th. These individuals have been helping deliver meals through Meals on Wheels. They've been helping at our food pantries to pack and to distribute food. They've been doing grocery shopping for people who really either aren't able to grocery shop or shouldn't be grocery shopping. And we've had a number of people volunteer for our Medical Reserve Corps. RSVP is partnering with COVID and to screen volunteers and funnel volunteers that way. We've had a number of virtual volunteers who've been reading to children in 1st and 3rd grades in Norristown. And of course, as you've heard us mention before, we have thousands, well over 1,000 people on our Make Masks for Montco, PA Facebook page. So if you are able to make a mask and have fabric and other things and know how to do that, then please check out Make Masks for Montco, the number 4, Montco, on the Facebook page. And there are people who need masks, and we're trying to connect the two of you. And I want to give a special shout out to the Korean American Association of Greater Philadelphia, which is helping the county with about 800 masks in total. We're so grateful for this. They're beautifully handmade masks and are already being distributed to our county employees for their use. The county is paying for all of the materials, all the fabric for these masks, but these wonderful volunteers are sewing all of these masks for us, and we are so grateful for that contribution. So as you go through these next few days and weeks to come, just think about if there's something that you can do. There may be a way that you can volunteer to help answer phones or do some other task. You can reach out to RSVP, and they will be happy to get you connected to opportunities that are there for you. And with that, I will turn over to Commissioner Ken Lawrence.
Good afternoon. I'd like to give an update today on the Montco, PA COVID-19 Response Fund. This fund was established on March 26th and is being administered by the Montgomery County Foundation. You can see on the poster here some of the founding partners of that. As of today, close to $300,000 has been raised for the fund, including almost $40,000 from private individuals. And the fund has contributed $212,000 to 63 nonprofit organizations throughout Montgomery County. This is a community-wide effort to support the immediate needs of residents hardest hit by the pandemic. 100 nonprofits have applied for relief grants. Projects are being prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grant funds were distributed to a variety of nonprofit organizations serving every area of our grantees include food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchase for nonprofits, continuing essential in-person services, and emergency shelters. More funds are urgently needed to support the efforts of our first responders and social safety net providers. So please help support this if you are able to do so. We have information on the fund on our COVID website. And it's not t-shirt weather today, but I did want to, I'm not going to model it, but show our Montco Strong t-shirt. This shirt was created by the Valley Forge Tourism Board, and they partnered with a Montgomery County business, DJB Specialties, which specializes in custom apparel and promotional products. The shirt's $25, and all proceeds benefit the Montco COVID-19 Response Fund. DJB Specialties is manufacturing the shirts in an appropriate and responsible social distancing manner. So we want to thank the Valley Forge Tourism Board and DJB Specialties for their support of the fund and the shirt. I've ordered mine. I also like to announce on behalf of the Montgomery County Office of Senior Services that they are continuing to accept referrals for services during the pandemic. Assessments for services are being conducted over the phone. If you suspect abuse, neglect, financial exploitation, or abandonment of a person over the age of 60, please call our Protective Services hotline at 1-800-734-2020. That's 1-800-734-2020. The office is also offering well calls to Montgomery County residents age 60 and over. We know a lot of seniors are home alone right now, and the purpose of these calls is to prevent the feeling of isolation that some are feeling during the COVID-19 pandemic. So if you'd like to make a referral for this service, there's a form at www.montcopa.org/senior-services, or you can call the office at 610-278-3601. And with that, I'll turn it over to Commissioner Joe Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. The ongoing judicial emergency for Montgomery County, ordered by the President Judge, has closed the Register of Wills office through May 31st, 2020 for all but emergency needs. However, we recognize that despite the ongoing COVID-19 crisis, estates of deceased individuals still need to be handled through probate filing, and people still want to get married. To help meet those needs during this time, the Register of Wills has established a pilot program that utilizes video conferencing technology to open estates and to obtain marriage license. Under the new procedure, you can open an estate for probate or obtain a marriage license by calling the Register of Wills at 610-278-3400 to leave a message, or email rowsupport@montcopa.org, where you then provide your full contact information, name, email, and phone number. For probate, mention in your voice message that you would like to request to open probate, or include that description in the subject line of your email. You will then be contacted by a representative of the Wills office for further instructions on how to set up a video conference call. On the video conference, you will then have the ability to swear in executor or administrator and make necessary payments. To obtain a marriage license, you will follow the same procedure by calling the same number, 610-278-3400, or emailing rowsupport@montcopa.org with your full contact information stating that you want to request to apply for a marriage license. You will be contacted by a representative of the Register of Wills office for further instructions on setting up a video conference to take the oath and sign the marriage application. Complete instructions for opening estates and applying for marriage license can be found on the Register of Wills page on the Montgomery County website, montcopa.org. Then you click the tab for departments and the next tab, judicial, and you'll see Registers of Wills under that tab. Also, a quick update on the Montco recycling program. All Montgomery County recycling events are canceled through the end of May. Safe recycling measures will continue to be reassessed under the current COVID-19 emergency orders, and we will announce the status of June events in the future. You can check the website montcoparecycles.org for the most up-to-date information. Thank you, and I'll turn it back to Commissioner Arkush.
All right, thank you. Happy to take questions. Tiana, you're up.
The none at all, correct?
No.
Okay.
So if it's an essential worker, for instance, a first responder or something along that line, we are doing workplace contact tracing so that we could understand if, say, an EMT was concerned or knows that they were exposed. Then we would do contact tracing within that individual's work unit to see if there were other individuals who needed to go into quarantine, given that these are people that are directly contacting the public.
So if we know those, what about people who work in the nursing home, since we know some of them don't live in the area, to try and figure out if they're, I guess what I'm trying to ask is, of the new numbers, are we able to determine if these are people that are coming in contact with perhaps essential workers or nursing home workers or some obvious reason, or is there still no way to know if they're getting it from being in a grocery store or something like that?
We're really not in that particular instance, that's correct. Because a lot of the nursing home staff don't even live in the county, which further complicates it. So we are trying to at least identify within the facility, or at least let me back that up. We let the facility know, if they don't already, that they have somebody positive. Sometimes they're telling us that they have a positive. And then it is at this point on them. They have a whole set of guidelines from PADOH about how they're supposed to manage either staff or patients that are positive within a facility. And we are offering guidance and any assistance that we can over the phone to see if they have questions, if we can help them think through things, and are starting to go in and visit some of these locations if they will let us come in to visit.
So then we still have the spread despite the low numbers, the testing, the change in testing, and this is not
Correct.
over.
So it is not over at all. The question is this over? No. So I think what I can say with some degree of certainty is that if you look at just the community itself, and when I say that, I mean the individuals that are able to get to the drive-through testing site and be tested there, it does appear that those numbers peaked April 5th and 6th, when 24% of the people that we tested at that site were positive on both of those days. Our recent numbers from Thursday, Friday of last week, when we reopened, were down to about 14%. Our last couple days at the Temple Ambler site, we were at 16%. So I think, that looks like a pretty steady decrease there. But the nursing home numbers, the long-term care facility numbers, are rising.
And then with testing, were there any other changes besides the self-testing? Is it going to different labs? Is there a reason why you're having this delay, do you think, in getting the test results back, or is it because more areas are testing now, so more tests are being processed?
Well, actually, we got results back as quickly as we've ever gotten them back from Thursday and Friday, and we got a good chunk of Saturday. So we were actually feeling really encouraged because it is the same lab. It's LabCorp. It's the same, contract that we had before. But we were actually getting those results back much more quickly. For some reason, there seemed to be a hiccup yesterday. And so I'm hopeful that this was just a one-off because we were actually doing much better than we had been at Temple Ambler in getting those results back. So I'm hoping, they say they've increased their capacity, and I'm hoping that will impact us positively.
Any efforts were thought to trying to do a county-based antibody testing site at some point? I know that we're still in the containment, not necessarily the research, but...
Yeah. So the question was about doing an antibody testing site, and you mentioned the word research, and I think that's exactly what it is. So let me talk a little bit about the antibody tests. First of all, none of them have been robustly evaluated in the way that a test of this type would typically be evaluated by the Food and Drug Administration. They've been sort of rushed through a very accelerated process, and what we are hearing from people out there in the field, and you've certainly seen this reported, is that there's some questions about how accurate these antibody tests really are. So that's the one thing. But if they were accurate, let's assume they get to the point where they are accurate, then the next question is, what does it mean to have antibodies? So it would certainly mean that you've had the disease. I think that's a fair assumption. But what we don't know yet is whether or not having antibodies gives you any degree of immunity. And we are starting to see some case reports out of Asia that people that had supposedly been sick and recovered and were back out in the community are coming back anew testing positive.
So we're not really sure yet what antibodies mean, and hopefully, we all hope that having antibodies will give some degree of immunity, but we don't know for how long. It could literally be days or weeks. If we're really lucky, it will be months or a year, but we don't actually have any of that information yet. So right now, our priority is increasing our access to tests for the virus so that we can work in a much more rigorous and data-driven way to help businesses come when the time comes to be able to say, okay, we can test a set of workers, and we can say on this day, we know that none of these people were positive for the virus. And if they continue to practice social distancing, etc., hopefully they'll stay that way. And that's a group of workers who could go back to work, you know, that type of an approach. If the antibody test can be validated and really do turn out to show that if you have antibodies, you have some immunity, we would absolutely pursue that.
Is one question from Vinnie Bella, the Inquirer. Delaware County officials have notified about 400 employees that they're being furloughed due to restricted operations at the county courthouse and government center. Has Montgomery County furloughed or laid off employees, or do you have any plans to do so in the coming weeks? If so, is the county contractually obligated to support workers' health insurance?
So the question made note that one of our neighboring counties has announced that they're furloughing some workers, and has Montgomery County made any plans to do that, or are we considering it? So right now we have not furloughed or laid off any individuals. We have this as a regular ongoing discussion with our Chief Financial Officer. As of right now, there are no plans to furlough anyone, but we are revisiting this every couple of weeks as we reassess our financial situation here in the county.
One more. The state has now said that it's expanding the number of deaths considered to be COVID-19 related. Is Montgomery County doing the same?
So what we're working to develop, and we don't have it yet, are two lists. So the list that we have been giving you consistently over time are individuals who have passed away and have a positive test for the coronavirus. There are other individuals who are considered probable or possible COVID-related deaths because of their symptoms or the circumstances of their death, but for which there is no test. So we are going to work going forward to have kind of two lists. We think it's very important that we stay consistent in reporting the number of people who we know with certainty because they had a positive test had COVID-19, but we are working to then also have a separate number that are people who the circumstances would suggest that that is what they passed away from. So we're not quite ready for that yet, but we are working on that. Yeah. Okay, that's it, Teresa?
Yeah.
Okay. All right. Thanks, everybody. We'll see you tomorrow.